Hello. So I was diagnosed with basal cell carcinoma, and I don't know if you can see it here. I'm going to try showing you. Uh, you can see like right over here. There's a little mark, right? And it looked like a pimple at first, but it wasn't behaving like a pimple, and came out of nowhere. I thought it was a pimple, so I tried popping it. It bled a little bit, scabbed up, went away, came back, and it just didn't seem right. So I went to my doctor for something else, and they says, "Doc, take a look at this. What do you think? Is this something I should get looked at?" And he says he would. I'll go to. He says I'd go see a dermatologist, and I went. I never been to a dermatologist before. Didn't know what to expect. Um, but I had a couple of blotches here. They're all gone now. But he looked at those. He looked at something on my scalp, and he's waving it all off. Then he sees that thing on my nose. He says, "This, we're going to take a biopsy of this." Took a biopsy. I go back 2 weeks later. Sure enough, it came back positive for cancer cells, basal cell carcinoma. I never heard of it. I know there are different types, but supposedly if you get skin cancer, this is the type you want. It's not malignant. It doesn't spread to other areas of the body. It's local. If left unchecked, if you don't do anything, it could grow bigger and destroy bone and tissue. And you have other issues to worry about. So I told the doc, yeah, let's cut it out. Take it out. He says, all right, but it's going to leave a scar. And I'm like, all right. He says, you sure? It's a scar. He said, do you want a plastic surgeon? I says, okay, if my plan covers it, sure, why not? So I had to wait until the surgeon and the plastic surgeon work on the same day and where there's an appointment available. So it was a few weeks out, and that was the worst part, having to wait, knowing that I had cancer on my nose. It just bothered me. But anyway, yesterday was the day. So I had a 9 o'clock appointment in the morning, and I got there like 8:30 in case I had to fill out paperwork or whatever. There was already people there. So they call my name. I go into one of the rooms at like 9:15, and this is not the dermatologist. This is the surgeon. I never met him before, but he introduced himself. He told me what he's going to do. Explained the process, and we got started. So he numbed me up, and he made an incision, and he took out what he believed was a fair amount, because they go around it. I don't know how much more, but they have a lab on site, so they take what he takes out and they process that. They freeze it, they dye it, they flatten it out, they know exactly the orientation of it. And the surgeon, like an hour later, looks at the slides and sees if there's any more cancer around the perimeter. And if he does find cells, then he has to go back, and he knows what area. Like, they don't do another big circle, they just target that area where they found more skin cells. So get called back in, does another cut. It takes like 10 minutes. But then there's that process again where they have to do it all over. They freeze it, they dye it, they slice it up, they put it under cells, under a microscope. The doctor looks again. Unfortunately for me, still found more. So for the third time, I had to go back in. He takes out more. Then they go through that whole process again of freezing it, dyeing it, putting it under the microscope, and so on. So that time it was clear. And by now, I don't know what time it is, but a good 4 hours passed by. And I'm waiting to be closed. Well, actually, I didn't even know. They didn't even tell me if I had to go back in, if I was clear or they needed to take more. But it wasn't like the first few times. That was within an hour. I was back in that chair, taking more out. So an hour and a half goes by and people are complaining. There's an office full of people with bandages like this on their head, on their cheeks, on their legs, on their backs. And people are complaining. They're getting anxious. It's almost like a factory. So anyway, they call my name, and they said, good news, there's no more. We got it all. We're going to close you up now. I said, great. So they put me in a room, waited about 20 minutes. Plastic surgeon comes in, introduces himself. He tells me what to expect, what he's going to do, and he's looking at my nose, figuring out the best way to close up that hole. And he came up with a game plan. That took about 15 minutes. And then he also numbs me up. He's injecting me with local anesthetic all over, and I can't feel a thing. I got to say, I really didn't feel anything other than the prick of the needle. That was like the worst part of this whole process. So he injects me good, and he disappears. And like an hour goes by, I don't hear from him. I don't hear from anybody. And by now, I don't know what time it is, maybe 3 o'clock. I thought I was going to be out of there by 3. So I called someone who was going to pick me up. I said, don't leave yet. They didn't even start. And I'm laying down on this, it's not a bed, it's whatever the table is, the operating table. Very uncomfortable. They had problems with this one too, with the headrest. So I'm cranky, tired, you name it. I haven't eaten. My stomach is growling. Nobody's coming in. And I'm yelling, hello, anybody home? I want somebody. I want some attention. I want to know what's going on. So a girl comes in. She apologizes, explains that, sometimes these things take time. They're not what it seems to be. Like a repair could be longer than what you initially think because the hole is larger or whatever. But she assured me that this plastic surgeon is finishing up with another patient and he'll be in shortly. Well, I saw him about 15, 20 minutes later. He apologized. I said, look, doc, just get me out of here. I said, I don't care anymore. Just close me up. I got to get out of here. I need to leave. And he's like, no. We can't just let you leave with that. And I got a little annoyed with him. Not so much at him, just the whole day. It just didn't seem right. They didn't care about the people. Just get as many people as we can. Let's get them in and we'll close them up. Where are they going to go? Where are these people going to go? They have no choice but to wait. I mean, there was no coffee service. There was nothing. So I got into it with him a little bit. And normally I'm the kind of guy that likes to ask questions about what's taking place. Why are you doing that? Not questioning the person, but just to learn. We didn't say 2 words to each other, unless he had to tell me something. So anyway, he closed me up. And by now it's like 4 o'clock, and he's giving me directions on how to treat this, and it's just going in one ear and out the other. I just want out. But he says that the one thing is to do cold compresses on the hour, every hour. Do cold compresses, and he's, I got prescription for antibiotics. I took them that night. Last night was the first night I started them. And there's also a cream, which won't start until Friday. The surgery was yesterday, Wednesday. Today's Thursday. The bandage comes off tomorrow, and it stays off. And I start using the antibiotic cream with a Q-tip, just running it down. I could shower. I should clean it with soap and water, and when I get out of the shower, then I put that ointment on it. Bandage, he says, is not important, but it's pretty nasty. I saw what it looks like without before they put the thing on, and I don't want people looking at it. They'll be disgusted. So I'll probably get a small bandage just to cover the scar, but it was a hole. And, they can't really stitch up a hole, so they make like flaps. So there's really an incision that starts at the top of my nose and comes down. Let me see, I'll show you a picture. I think I have a picture of it. I took a picture of the hole and the sutures. This is worth seeing. If you're squeamish and you're going for this and you don't want to see it, don't look. It's okay. But let's see. Okay, here's the hole. Now, I don't know. This is after the first time. It probably got a little bigger. But that's the hole the first time that they took it out. Right? It was a very small pimple. So he did go around it a good ways more. But anyway, they had to go back 2 more times and dig it out again. And they can't just stitch that. That's why sometimes they'll do like in the shape of an eye so that they can get a flat seam. But I'll show you now what these stitches look like, what he did, how he looped it around. And believe it or not, this is a plastic surgeon, and so I don't even see the hole. The way he closed it is pretty amazing. But, in 3 months' time, that's supposed to be, it's hardly noticeable. Who knows? It's pretty nasty. But we'll see. So next Wednesday, I go take the stitches out. The ones inside will dissolve on their own. So one thing I'll tell you is get the earliest appointment you can, because you'll be pretty much in and out. If you're lucky enough where they get it all out the first go, you should be in and out. That's like an hour. I think an hour, and you'll be out of there. If they have to go in again like they did with me, maybe a little bit longer, but once people start coming through that door, it's all over. So my advice, get there early. I was in some pain yesterday. He says if you're in pain, take some Tylenol. So I had that home. I had Tylenol, I had ibuprofen. You could take those together. That's why I did ibuprofen and a Tylenol. I took Tylenol, an hour later I took an ibuprofen. It throbbed a little bit, but the cold compresses work. I used a can of frozen peas, a bag of frozen peas and carrots. That worked well because it kind of contours rather than ice cubes, but I also have one of those ice cube packs. I was using both, and I tried to do it on the hour every hour. It got a little cold for my eye though, so I was expecting today to be worse than yesterday, and I gotta say, I was pretty good. And when he was sewing me up, I heard noises that you shouldn't hear or that you wouldn't think. Like, it felt like he was digging stuff out. I don't know. Didn't sound right. But if I was talking to him or would have asked him, "What are you doing? What's that noise?" It feels like you're hitting something hard. But I was being pig-headed. So I missed out on a learning opportunity. But have patience. I had my iPhone. I played my games. Read a book. I have a lot of books electronic. Watch some YouTube. Could be a long day, so try to get an early appointment. You'll probably be better off for it, and you'll be out earlier. Otherwise, prepare to stay a while, and it's probably worth getting a plastic surgeon if your insurance covers it. Look into that. Other than that, I gotta say, it's the day after, and I'm doing okay. I can't wait for this bandage to come off. It comes off tomorrow. My daughter cut a little bit here for me because the way it was taped, it was like poking in my eye, and I didn't feel this yesterday because everything was numb. But it's so much better now. I can't wear glasses. I wear contacts. They're still in, but I couldn't get glasses on this. It just wouldn't work. So if you wear glasses, let the doctor know. Maybe they'll tape it a different way where you can still put your glasses on. I don't know. But I wasn't able to put mine on. And I'm not really able to take my contacts out. I got no room here to work with. So, but if you're going for this surgery, don't sweat it. The worst thing is time. Patience. I really didn't feel anything. Once that needle numbs you up, you're pretty numb. They could do anything, and you're just not going to feel it. It's sore and tender afterward. It throbbed a little bit, but Tylenol should take care of that. And that's about it. So I'll give an update after the bandage comes off. I'll show what that nice little scar looks like, and what I'm using to treat it. But I'm pushing 60. I'm not making movies. I'm not an actor, so who cares? It is what it is. Okay, folks, if you have any questions about Mohs surgery, I'm sure they're all different. I don't know if I can answer all the questions, but I'll be happy to at least share my experience with you. And good luck. Okay, be well.